How are the hospitals doing amid ease restrictions? Joining us now is Dr. Jonas del Rosario, the spokesperson of the Philippine General Hospital. Good morning, Dr. Jonas. Thank you for being with us again this morning.
Good morning, Ria, and to your televiewers.
So, Doctor, how is the situation in PGH? Are you feeling the effects of the further decrease in COVID cases, and are there indeed fewer COVID patients?
Yeah, we do have fewer steady decline in the numbers. Right now, we have 107 confirmed COVID patients out of our 300 beds, so that's about 35% utilization rate of our beds. About 75% of our ICU beds are occupied. So this is the lowest so far that we've been since the surge. So we're coping up, and in fact, we are able to open now some of our non-COVID wards.
Okay, that is great, because we do have some hospitals saying that they are receiving more non-COVID related cases these days. Is that true for PGH as well?
It is true. In fact, we're having a problem now. Our emergency rooms now are really having so many non-COVID patients by a ratio of probably 4:1. We do not have any more a long waiting list for COVID. We're able to accommodate them, and the transfers are easily admitted to our hospital. It is the non-COVID patients now that we're trying to find a way to get them back. You know, we had to close our non-COVID wards because of the COVID surge, but now we're going back to reopening our non-COVID and try to transfer our manpower back to the non-COVID operations.
Speaking of non-COVID cases, doctor, those patients, what do they come in with? What are they sick with?
The usual, these are our usual patients actually. They have heart diseases. So some will come in like heart attacks, strokes. Then some of our patients who have cancer, some who need surgical intervention right away. Those who are coming for trauma, a lot of cases with infection. So we have to accommodate them. Our emergency room right now is trying to coordinate some of these patients so that they can be admitted, because right now there's no way that we can admit all of them. One big limitation that we have, Ria, is even though we have less COVID patients, our manpower, our nurses is limited. So either you get them from the COVID and bring them and reassign them to the non-COVID. We cannot operate on full scale for both services at this time.
Right, so it's manpower. Now, the capital region will remain under alert level 3, at least that's the plan, until November 14th. But there are calls to further ease it down to alert level 2. Doctor, what are your thoughts on this?
I think as long as the people follow the protocol, then it's reasonable to now readjust and go to level 2.
Right. You mentioned your healthcare workers, and I imagine that they're awaiting the start of the rollout of booster shots. Tell us more about this and about your healthcare workers. When do you think they can start getting those shots?
We have been waiting, trying to really wait for the go signal of DOH and IATF for this rollout. We have a lot of frontliners who are waiting for their booster shot. So it's just a matter of when we're ready for the rollout. We're also trying to find out what vaccine will be given to us.
All right. It's still on the topic of healthcare workers. You know, a lot has been said about their psycho-emotional health during the pandemic. Do you feel that has improved because the pandemic situation in terms of the number of cases has improved?
Yeah, people are feeling much better now that we can handle the volume. It's always a relief that we are not getting overwhelmed. So hopefully we will have the numbers will continuously decrease, and we will have a better Christmas.
Yes, a better Christmas, please. Lastly, doctor, about hospital supplies, how are we doing on that? Do we have enough? Is there any kind of shortage you're experiencing?
No, our supplies are enough. equipment is okay now, that especially now that the numbers are decreasing. We're just the tocilizumab is a medicine that I think every hospital does not have, and we're just waiting for the supply of that.
All right. Thank you, Doctor. Always a pleasure speaking to you. That was PGH spokesperson, Dr. Jonas del Rosario.